Good afternoon, everybody. Because of the smoke and the real crisis that we're in with the environment, we're shifting course and we're going to be in here. So we're not going to be chanting or anything like that, but we're going to continue with Oppressor today. And for folks who don't know me, my name is Signe Espinoza, and I am the Executive Director at Planned Parenthood Pennsylvania Advocates. And I'm here to get right to it. This is the first time ever that we have had a pro-sexual and reproductive health majority in Pennsylvania's legislative history. We have also been able to maintain a pro-sexual and reproductive health governor for the past 8+ years, right? And that's great and everything, but that's not enough. Despite this progress, despite abortion being the top issue in the midterms that won through and through, and despite increased support for abortion access across the electorate, across independents, Democrats, Republicans, and despite the fact that we're still in an abortion crisis, our state budget looks the same. Millions of dollars are still going to crisis pregnancy centers. These are fake clinics that are not real providers and provide biased and inaccurate information to pregnant people. We've seen no movement on pro-sexual and reproductive health care bills. This is unacceptable, which is why we are here. A lot of members have asked, we didn't know much about today. Today is about their constituents who came from Western Pennsylvania and Bucks County and Philadelphia. We are nearing the 1-year anniversary of the fall of Roe, and our state continues to fall short. We're tired of the excuses, of the hands being tied. This place needs to start acting, and we can't wait. We know our healthcare can't wait. We know livelihoods can't wait. 18 freestanding clinics, abortion clinics in our state is unacceptable. 85% of counties without an abortion provider is unacceptable. 48% of Pennsylvanians living in counties with no abortion provider is unacceptable. Crisis pregnancy centers outnumbering real abortion providers 9-to-1 is unacceptable. We cannot sit days like this out and not with these numbers. We need to make it clear to our leaders, the ones that we elected, that it's not enough to knock on our door and ask for our vote when they need us at the ballot. They need to show up for us all other 364 days, not just on Election Day. Promises were made, and that's why we're here. I know I sound like a broken record when I say this, but this truly is just the beginning. I know that together we can make change, and that's what we're going to do today. I want to make it clear that today we are activating a different kind of pink. We aren't asking anymore. We're going to be demanding it. So are y'all with me? Don't chant too loud. I want to thank our staff who put this together, the supporters who I said came from Pittsburgh and Bucks County and Philly and everywhere in between. And I want to just close by saying one of my favorite Planned Parenthood sayings of all time. When I learned this saying when I was actually a patient advocate at Planned Parenthood Southeastern Pennsylvania, and I started my journey in advocacy after having had an abortion. And that is, there is nothing about us without us. And I think that's the theme for today. Now I have the pleasure and honor of introducing Sydney Etheridge, who is the CEO and president of Planned Parenthood Western Pennsylvania and a total badass comrade in this work.
Good afternoon, everyone. My name is Sydney Etheridge, and I am so excited and honored to be here with all of you today. As Signe mentioned, I'm the president and CEO of Planned Parenthood of Western Pennsylvania. Our offices are based in downtown Pittsburgh, but we cover the 26 counties of Western Pennsylvania. So all the way down from West Virginia, west to Ohio, and north up to New York. Now, we know firsthand in Western Pennsylvania the effects of the post-Dobbs world. We see about 3,000 abortion patients each year. And prior to the fall of Roe, about 16% of those patients were from out of state. Since we saw Roe fall, a quarter of our patients now come from places like Ohio, West Virginia, and as far south as Texas, and as far west as Minnesota. And so we know what it feels like to have to keep our doors open during these trying times to make sure patients, whether they are down the street, down the turnpike, or far down south, are getting the care that they need. But I will say this has been difficult. One of the hardest things about the fall of Roe is that it happened at the heels of the COVID-19 pandemic. For those of you who don't know, Pittsburgh is a very big medical city, and the healthcare industry was hit hardest during COVID. Staff turnover, staff burnout has been something that every healthcare provider has dealt with, but uniquely abortion providers like us and Allegheny Reproductive Health Center, the only 2 abortion providers west of Harrisburg, have felt this time even more acutely. Because not only are we working to build back up our staff and infrastructure post-COVID, but we are doing it under the increasing demands and need of patient care all over the Commonwealth and all over this country. And so that is why we are here today, is to talk to our policymakers and legislators about the unique needs that sexual and reproductive health care providers and abortion providers like Planned Parenthood need during this time. The essential funding and resources that we need access to make sure that we are keeping our doors open for our patients, but also allowing organizations like ours to pay our staff a living wage, which is so important because they are at the front lines of the care and the service that we are providing every day. And so I am honored to be here with all of you in this moment, because we know that Roe was the floor, and we know that 18 providers in a state as large as Pennsylvania is not access. And so when I think about what we can build and what this movement can grow into, it will be much more diverse and inclusive and intersectional than Roe or anything else in this state could have ever been. And that is the future we are here today fighting for. That is the foundation we are laying. And I really look forward to having those conversations today and to continuing this fight alongside all of you. Thank you. I am now going to turn it over to one of our amazing patient advocates. Kirsten, the podium is all yours.
Hello, everyone. How are we?
Hello.
Hi. I was told that we can't be too loud, which makes me a little bit sad. However, I am glad we're staying inside and being safe. My name is Kirsten Jordan. I am an artist, comic, and advocate from Lancaster City, District 49. Woot woot. And I am just here to share my story, and I just hope that a lot of you who may be lobbying for the first time are encouraged and feel comfortable to share your stories with their representatives, because it is very important that they hear actual stories from their constituents. So yeah, like I said, I am from Lancaster City. Lancaster City, while I was growing up, thankfully had a Planned Parenthood right downtown. And I was lucky enough to have my first appointment there with my mom. I remember sitting in the waiting room with her and us having the ability to make other patients feel comfortable and not feel too nervous while waiting to be seen. One of the most important things that happened for me was that the staff was very well informed with working with patients who have experienced trauma, who come from different diverse backgrounds. And it was my first experience, especially in any sort of medical facility, where I felt heard by the folks who were seeing me. So at the time, we decided to go with a plan that included me getting an IUD. For those who do not know what an IUD is, it is a form of birth control that is very invasive to have the procedure done. And I feel like Planned Parenthood did an amazing job of not only making sure that I got the care that I needed, but that I felt as comfortable as possible during something that is very invasive. 2 years after that, sadly, that location was closed down due to funding, and our city did not have access to Planned Parenthood. I believe at that time the closest center was somewhere in New York, which for a lot of folks is not very accessible. During that time, I was also raped, and instead of being able to go somewhere like Planned Parenthood that has folks who are very trauma-informed, I had to go to my local general hospital, and I was seen by a doctor whose initial concern was not my safety and well-being, but rather, was I going to press charges? Who did it? And because obviously this was a doctor I did not know, I did not feel comfortable having that discussion. And I made it clear that all I would like to do was have a rape kit test done and have STI testing done. And I was refused that care based solely on the fact that I would not answer the doctor's questions about whether or not I was pressing charges. Yes, it was an old white man, and sadly, that is a stigma that a lot of not only Black and brown folks, but folks of different gender identities experience, where they are not listened to when going for their care. So thankfully in Lancaster City, that is no longer the case. We do now have a new center back opened up. And thankfully I was able to then get STI checks done, all clear, and get the health care plans that I needed done. I feel lucky that in my case, I had preventative care. I had an IUD. I had folks to talk to and orgs to reach out to get help. And that is sadly not the case across the board in our country. And I am very proud to stand up here with all of you who are doing the hard work to make sure that not only that we continue to get the care we need in Pennsylvania, but nationwide. I absolutely hate when people hear my story and they go, I am so sorry. Anyone in this room who is here listening and doing the work doesn't need to be sorry, because you're doing what you're supposed to be doing, and that matters a lot, and I hope you all know how important it is what you're doing. I just want people to share stories like mine, because mine is not, sadly, a irregular story to hear, but making sure that folks know what we really do at Planned Parenthood. We do cancer screenings, we do STI testing, we do actual medical care that people need to access without worried about their doctor's own stigmas. So thank you all for being here. Thank you for doing the work that you're doing, and keep on pushing through. I am now introducing Dale Steinberg to come up and speak with you all.
Hi, everybody. I'm Dale Steinberg, President and CEO of Planned Parenthood Southeastern Pennsylvania. I'm happy to be here today, feeling energized, feeling like it's time to finally effect change. I'll tell you a little bit about Planned Parenthood Southeastern Pennsylvania. It's headquartered in Philadelphia, and we serve 4 counties in total. A small geography, but lots of dense population. I mean, they're not dense, the population's dense. Planned Parenthood Southeastern Pennsylvania provides sexual and reproductive health services to about 34,000 patients every year across the 4 counties and 10 separate health centers. We serve as a safety net provider in our area, and we offer services including, not limited to, a full range of contraceptive services, cervical and breast cancer screening, STI testing and treatment, HPV vaccinations, gender-affirming care at 4 locations, which we're really proud of. And we also proudly provide 8,500 abortions every single year. We focus, without apology, by the way, We focus on reaching vulnerable populations and meeting their health care needs. Our patients are primarily young, and many of them have limited economic resources. We turn no one away based on their ability to pay. We work tirelessly to ensure that all people have access to the essential information they need to build healthy lives and strong futures. To keep our services affordable, we offer a sliding fee scale. And last year, I'm looking for the stats. We saw 10,000 patients last year for reduced fees or no fees, but we had to cover those at $3.5 million because that was unreimbursed care. Our patients and staff also deserve to visit our health centers free from harassment and intimidation. We've actually seen since Roe was overturned, an increase in aggressive protester activities. You would think they would be satisfied, but geez, it's still legal in Pennsylvania. So they're there, and they're getting increasingly aggressive and committing deliberate illegal tactics to interfere with our medical services, threaten our staff, and prevent our patients from receiving care. Now, unlike a typical healthcare provider, we dedicate significant resources to security measures to ensure physical safety at our centers. Despite the many challenges of delivering affordable health care services, we continue to prioritize protecting and expanding access to care and enhancing service delivery to ensure that all patients receive the high-quality care and high-quality experience they deserve. Our patients depend on us to be there for them, and we strive to deliver for them. With sexual and reproductive health services under constant targeting and attacked by extremists, and with skyrocketing costs of providing care, we call upon the Pennsylvania legislature to recognize and act upon the crisis moment that we're in. We call upon them to push proactive legislation like House Bill 1140, expanding access to contraceptives, and dismantle barriers by investing in accessibility to Planned Parenthood's full range of services, including abortion services. And as my dear friend and colleague illustrated in Sydney Etheridge in Western Pennsylvania, she knows how important access to abortions is. And abortions remain safe and legal in Pennsylvania, but with unnecessary and burdensome regulations and a shrinking clinical network, only 18 in Pennsylvania, they're too often inaccessible. We are in a crisis moment for access to abortion service. So why in heaven's name are we funding crisis pregnancy centers? We need to do better for the patients we serve. They expect this from us, and we owe it to them, and we will continue to deliver with the legislature's help. And so thank you very much. I'm going to introduce Rabbi Ari Cohen from Bethel Synagogue right here in Harrisburg. Oh, there you are.
Thank you, everyone, for having me, and thank you to all those who spoke so powerfully and shared their stories. I'm Rabbi Ari Cohen. I'm here to represent a religious perspective because so often the narrative formed around the religious perspective on abortion is one of anti-abortion, but I'm here to say that in Judaism, abortion is very much permitted and sometimes even required for the health of a pregnant person, and that very much makes us pro-life. So, to be clear, Jewish law is very pro-natal, including the commandment to be fruitful and multiply, right, in Genesis. And Jews take this law very seriously. And this makes us pro-life. And Jews are also allowed to violate even the most sacred laws in order to save a life. For it is said that to save a life is to save an entire world. Yet Judaism places the life of a pregnant person above the potential life of a fetus. Until birth, a fetus is not considered a full life in Judaism. Thus, Jewish law allows all abortive measures necessary for the health and the well-being of those who are pregnant. One of the key biblical texts in this debate is from the book of Exodus in chapter 21, which Jewish tradition has always interpreted as proof that a fetus is not considered a life yet. As it says, when men fight and one of them pushes a pregnant woman and a miscarriage results, causing the death of the fetus, but no other damage ensues, the one responsible shall be fined a fee according to the damages, and payment shall be based on that reckoning. And so Jewish law has always interpreted that the fact that there is a fine and not a life for a life is construed to mean that that fetus is not considered a life, because it says if other damage ensues besides the miscarriage, in other words, damage to the health of the mother, then the penalty shall be life for a life, but not because of damage or death of the fetus. So this interpretation extends out to where the rabbis in ancient times in the Talmud interpreted the fetus as essentially a part of the mother's body, just akin to her leg. And so when does Judaism, in fact, begin to consider a fetus and protect a new life? Jewish legal code clarifies that until an infant has fully emerged in birth and begun to breathe on its own, its life is not accorded the rights of full protection. And in fact, Jewish full burial rights are not even afforded to a newborn until 3 months of life. So there's really a strong transition period into full consideration of rights of protection of life for a life. And so the priority here is clearly given to the one who is given birth over the life of a fetus. And only once the baby has completely emerged and is breathing do those protections begin to be afforded. And abortion is permitted, therefore, and sometimes even required to protect the life of a mother, even to the point where if mid-birth, before the fetus has fully emerged, the danger is caused to the life of the mother, it is permitted to end the life of the fetus mid-birth. And one rabbi from the 18th century even said that in cases of severe emotional distress, or perhaps not severe, emotional distress to the life of the mother or the pregnant person, as the case may be, we would permit abortion. And so anti-abortion activists who call themselves pro-life are using a misnomer, because they actually are causing many unnecessary deaths of both people carrying babies and babies themselves. Forced birth, we have seen, takes lives. We have seen this increasingly since Roe versus Wade overturned and caused an avalanche of new anti-abortion legislation. Because of this, maternal death rates are 62% higher in states that ban or restrict abortion. How is that pro-life? 62% higher maternal death. And babies born in banned states were 30% more likely to die in their first month of life. And according to a new report from the CDC, in 2021, the U.S. had one of the worst rates of maternal mortality in the country's history. This is a 40% increase from the previous year. More than 10 times our rate in the U.S., a fully developed country by our own understanding, is more than 10 times those of comparable countries like Australia and Austria and Israel and Japan. And these rates are severely aggravated by racism, as Black women are about 3 times as likely to die during pregnancy, childbirth, or right after giving birth than white women. And this even as 84% of these deaths are considered preventable. So how is that pro-life? As we mark the anniversary of the Supreme Court decision to overturn Roe versus Wade on June 24th, this is in Judaism what we call a yahrzeit. We commemorate the anniversary of a loss. So as we commemorate this yard site, let us mourn the loss of life that has resulted from this decision and commit to fighting for the lives of pregnant people across the country as our religious and our American prerogative.
Awesome. We'll now take questions, but before we take questions, I just want to thank our members who are here today. I know we can always count on y'all, so thanks for standing in solidarity with us.